Well, there has been a lot of talk in the last few days about the COVID booster rollout, but what's the point of getting this third shot? Joining us live this morning with more is Dr. Gregory Schrank from the University of Maryland Medical Center. Thanks for joining us this morning.
Good morning, Jen. Thanks so much for having me.
Good morning. So let's start with that first question. What are the benefits of this booster?
Yeah, so there was quite a bit of discussion over the past couple of weeks within the FDA and the CDC around what the role exactly of boosters will be. And I think that that the focus of the CDC discussion in particular last week was on really who will benefit the most and in which way from receiving a booster dose. It's important to keep in mind that right now, booster discussions is primarily focused on those who received the Pfizer vaccine at least 6 months ago, received a full vaccine series with 2 doses previously. We're still waiting for guidance on those who received Moderna and Johnson & Johnson. But what has been observed is that over time, there appears to be an increase, a small increase in the risk of hospitalization with COVID-19 amongst the vaccinated, especially those who are over the age of 65 or live in long-term care facilities, which raised some concerns that boosters may be important as we are in the midst of a Delta wave with a very highly contagious virus.
And then it got expanded to different populations, not just those over 65, but anyone who is in close contact with the public, like teachers, grocery store workers, and then those with immunocompromised systems.
That's right. It's a quite complex discussion with a lot of factors involved, and I think that anybody who has read some news stories about this recently or watched some of the debate was really tuned into that. What I think a few key factors involved in this decision. First is, as I mentioned, our antibodies naturally wane over time. It's actually an important part of our immune system that our body's prepared for any different kind of germ that it's encountered, not really just focused on one in particular like COVID. The other, of course, is the Delta strain, which has emerged now many months after some received their first 2 doses of Pfizer vaccine, especially those who are essential workers, frontline healthcare workers, and older adults. And then also, we know that as the Delta surge continues in many states, the risk of exposure varies depending on who you are, and the risk of infection then varies depending on what your medical conditions may be, or who you live with at home as well, and whether you care for somebody who's vulnerable. And so all of those factors were taken into consideration when both the ACIP committee met to vote and Dr. Walensky, the director of the CDC, made her decision ultimately to expand a bit upon it.
So when it comes to the booster shots, it's expected that at some point Moderna will be approved along with Johnson & Johnson. But then we're hearing information that you should only get the booster that you got tied to the original shot. So if you got Pfizer, get a Pfizer booster. If you got Moderna, get a Moderna booster. Why is that necessary? If the antibodies wane over time, you can see why in a 2-shot process that was necessary. Don't get one Pfizer and then your second one Moderna. But what does the booster matter?
Well, that's a fantastic question. And actually, there's a lot of ongoing research looking at something that's called mixing and matching, really where you can receive one form of COVID-19 vaccine and then another brand name, which may even be not an mRNA vaccine. It may be something like Johnson & Johnson, which is called a viral vector vaccine, or AstraZeneca, which is quite similar. And some of the early data from Europe in particular has suggested that there may actually be some benefit to the immune system in receiving different types of vaccines that are slightly varied in the virus components that they contain, and really helping to expand the breadth of the immune response that you develop. And so I think many of us are looking to see some guidance from the CDC, as well as some regulatory wording from the FDA around where mixing and matching may have a role, especially as we look to boost really a quite large proportion of the US population. And some of the logistics of making sure that you receive the same brand of vaccine can be quite challenging. I'm thinking in particular also of people that have received Johnson & Johnson, which we know as a single dose vaccine had a lot of benefits as it was first rolled out, but has shown to have a lower antibody titers over time in comparison to the other 2 vaccines authorized. And so I think that there's some urgency there to look at Johnson & Johnson and provide some guidance to those especially older adults or immunocompromised patients who have received Johnson & Johnson a number of months ago.
So basically also stand by, because as so much information has continually changed and updated throughout the pandemic, this could as well.
Yeah, and I think one thing to really just make sure everybody's aware of is that the vaccines, even if we're noticing small increases in rates of hospitalization among older adults, they remain extremely effective at preventing the severe complications of COVID-19. So I don't want people to feel as though they're not protected from the virus right now, even as there's a discussion of boosters.
Gotcha.
Especially amongst those under the age of 65. They are continuing to hold up very, very well months after administration. And I think some of the discussions right now are quite nuanced and really focus on things like, can we make sure that our healthcare industry, that our educators are sustained and able to stay on the job and stay and contributing to patient care and contributing to the education of our kids as we move through the next few months and into the winter.
All right.
And that's really where I think it's important to focus, is that the primary series is what provides the most amount of benefit. And this is really just to make sure that we continue to feel the benefits of that for certain populations over the next few months.
All right, Doctor, thanks so much for joining us this morning. Great information.
It was a pleasure. Thanks, Jen.